Hi, I'm Marilyn Crawford, founder and CEO of HAWA Health and co-creator of the new HAWA You Health and Wellbeing School. We're so excited to introduce you to Dr. John Blaska, who is the president of Everspring Health, Health and Healing Cooperative. John, welcome.
Thank you, Marilyn. Good to be here today.
It is great to have you, and I'm very excited for our learners to hear from you a little bit more about Everspring and what you've been doing up there in Minnesota and how you want to reach globally different learners who are interested in integrative healthcare and try to understand how is that different from traditional healthcare. So tell us just a little bit about yourself and then we'll go ahead and start the interview.
Sure. I've been in the health sector for quite a while as a personal trainer many years ago, and I was a coach for quite a while. And then I got in 2002-ish, around there, somewhere around there. I got into the concept. Well, it was introduced to me that healthcare was having some problems and that we needed to fix it. And and the question I asked is, well, why don't we fix it? And so for me, the questions began with, what is healthcare? Where does it exist? And then how do we go about solving the issues that we have before us? And so that at almost 20 years later, I spent most of my time on integrative healthcare as a term that we're going to discuss today. But it's a good encompassing strategy for bringing the solutions that we need to healthcare in general, and it's accessible to people. And I think my advocacy of having this interview with you is to help make sure it's accessible. I think sometimes we can make things complicated and make it seem like the complications are a good excuse for not solving our problems. And I'm looking to truncate that and make sure that we have accessible healthcare for everyone.
Well, I applaud you at that. There are some people that still don't understand that it's broken. So they have the idea that if it's not broken, why fix it? But there are many more that do understand that these opportunities to create additional access and improvements are going to lead to better quality of care and better outcomes for people, not just here in the States, but across the world. So thank you very much for being one of those change agents. Now, tell us a little bit about the difference between integrative healthcare and what we would term traditional healthcare.
Well, so when I'll ask the question, when you say traditional healthcare, are you referring to the standard of care that we normally, most of us experience?
I am.
Okay. And so integrative healthcare really is a systems-based approach. The reference in literature goes back to even 1947, I think was the first reference I saw in literature. There wasn't an article, it was just a title, so I wasn't able to find out what the research or what the suggestion was at the time. But so the discussion's been going on for quite some time. The WHO in 1978 came up with a definition of primary care, which at that time they were identifying what was needed for the world in the last quarter century. And they felt that primary care was the target that we needed to hit. And their definition is is probably the best I've ever seen.
Okay.
I'll give it to you. It's essential healthcare based on practical, scientifically sound, socially acceptable methods and technology made universally accessible to individuals and families in the community through their full participation at a cost that the community and the country can afford and maintain at every stage of their development. And I just haven't seen a better definition. But in 2000, we saw the research conversation start to take off in the literature. And then you get into people like pluralistic care and team-based care and patient-centered care and all this type of stuff. And so for me, I broke it down into the basic terms. What is health? Health to me is the measure of a person's quality of life, both the objective measures that someone outside them can measure, and the subjective experience of that individual. And our job is to merge those two to cultivate a person's quality of life. Care is the attention or the facilitation of doing something to, reduce damage, reduce risk, improve the experience of that individual. Integrative is, if we just look at the root of that, integer, which is a Latin term, and integer means whole. So integrative really means to complete or to make whole. And so I think if we see this as, I think sometimes we'll see it as a brand. Like some people will just put integrative healthcare on a placard and have it, just be a branding kind of concept. My advocacy is that it should be a strategy for care, a strategy for the whole life of the individual, their experience, and then plus our objective experience of what we see or what we might make available to them that they might not be aware of is available to them. And so that to me is what integrative healthcare is. The traditional healthcare that we are aware of in the standard of care is very atomized. We break things down and it's very linear. And it has served us well. We came out of an acute care, a century of acute care, and ultimately, acute care has been the primary need of humans since the beginning of humankind. And the system we have helped reduce that, and now chronic disease is the #1 medical need worldwide. And so we made that transition because of the system we currently have. The challenge of that is that the system we currently have isn't really scalable or translatable to a chronic disease paradigm or matrix. And so that's really the difference that I see between integrative healthcare. So integrative healthcare would be inclusive of traditional healthcare.
Excellent. Well, thank you very much for explaining that. I think that that's important for people to understand, any similarities as well as differences. And I think when you more identified with the strategic nature of it, I think when I hear that something's strategic, that I'm feeling a little bit more power. Like I have a piece of this strategic plan. I'm going to be part of that plan, and I'm going to be reacting and participating. So I think I wouldn't feel as helpless as some patients feel out there in more traditional care models. So I like that. Now, I read a little bit about how you have foundational healthcare that fits into integrative healthcare. So tell us a little bit about that.
Sure. The foundational care for us, and so the paradigm, which would be a design kind of matrix, it would be a sphere and foundational care would be at the center. And the center would be is putting the patient at the center of that sphere. The concept being their life is full of many different variables, many different experiences, many different layers. And our job is to honor that or acknowledge that as a part of seeking better health. And so the foundational care strategy for us is, for the common terms, we would use a spirit, mind, and body. Mm-hmm. And the assessments we would use is, do I trust myself? And so that would be the spirit. And it's like, does the person feel comfortable enough to say, I'm content with myself. I trust that I'm at where I need to be. I trust that I can see the trajectory of my life ahead and feel comfortable with what I see. And then the mind would be is, can I process information correctly? So this is health literacy. Can I have an experience in my life and also know who to go chat with or who to go, what resources to leverage to improve my current experience. And then the body part would be is, do I have the physical capacity to do the work necessary to create the life I'm seeking to create? And so once we have that kind of assessment, if there is a less than ideal experience happening there, what we seek to do with the diagnostic is we ask about stress, diet, and sleep, because those three components are something that the individual can usually kind of connect with. Okay. They can, it's something that they from a literacy standpoint, they understand what those words are usually. They understand, they can usually identify things in their life that, that link to those words. So it begins the diagnostic for us, so we can start to look at how to start kind of peeling the onion on this. From there, we can start to dig into how those factors might actually be influenced by a more specific disease pattern, or conditions that, where we might need to drill down and be more specific in the treatment strategy. But that foundational care is, even if someone has a condition that we can't necessarily cure, we can seek to improve that quality of life. And it may be for the moment, it may be for the day, it may be for the month, and we'll take it one day at a time each time. And then, then it's our job as practitioners then to get into the medical or the conditional, the disease related, conditions to treat better. But if a person if we're reducing the stress for a person, improving their diet and improving their sleep, whatever we do from a treatment strategy, it's going to be improved, because those three key factors are for sure, part of that. So a fourth one in there is, a lot of people ask, well, what about exercise? And movement is absolutely imperative to our success. But that's more from the treatment strategy. That's like kind of the beginning of the treatment strategy. So the stress, diet, and sleep are more from the diagnostic strategy.
I love starting with those three key areas, and that, you have to have a starting point. And I was so curious about what that starting point would be. So I love how well thought out that is. And that, from a health literacy standpoint, as you mentioned, those are things that really do resonate with everyone. So I think that is an excellent starting point. And I also, when you were talking about peeling back the onion, as you were explaining this to us, I was thinking of an onion myself, and how many layers there are to our very complex bodies and our complex health. And so when you break it down, it seems like some of the foundational categories, I'll call them categories, you may call them something else. So skin health, for example, smoking cessation or addiction support, which is really important right now. More of a stress or mood disorder. I think you look at women's health, separately, although some of these collaborate together. Insomnia and sleep disorders, weight, having a healthy weight. And so those three key elements, everything that we've already talked about, even though that's just a few of the areas that you specialize in, they all do have that foundational core of those three, or then building on that fourth with exercise. But somebody who has chronic fatigue, for example, and is having insomnia and sleep, it's going to be hard for them to exercise. So you have to kind of pull it back and deal with some of those first three topics. So when you're talking about the key health topics, and just looking at the longevity within our daily life, how often are you working with patients that have multiple chronic health conditions, and you're trying to determine with that assessment that you just mentioned, what to tackle first as far as a condition standpoint?
Yeah. Yeah, so the list you have there is, it's kind of, this is where it's part of that, this is the marketing component of it. It's like, we just want to take care of people. We want people to live their best life. We want people to have fulfilling experiences. We want to facilitate and help them in any way we can. We want to meet them where they are, and we want to help them along the way. We don't want to pull them. We don't want to push them. We want to walk alongside them on their trajectory, on their path, and help them out. And so, as you kind of suggested, a lot of them are related, and the traditional model suggests that everything's atomic, and sometimes headaches are not linked with digestion, but the truth is headaches are often linked with digestion. And so chronic fatigue with migraines, or insomnia with digestive disorders, or so there's a lot of concurrent experiences there, and depending on whether the person is fully can be fully diagnosed in one of those disease categories or not is also part of the challenge, because a lot of times we don't have conventional treatment strategies unless they meet those standards. And so we can meet someone that may be early in the process that might not be quite to a migraine definition, but fulfills enough of the pattern that we can at least begin to work on dissolving that situation. And so, yeah, it becomes a challenge there for how do we present it to the public, and then, but also how do we meet each individual where they are. And so, but the foundational care allows us to do that, and we seek to, we tend to go back in their history. We look for a primary stressor. So when someone says I've had migraines for, X amount of years, we say, well, what happened, 15 years ago? Did you move? Did you change jobs?
Right.
A lot of this type of stuff we'll see is coming is around college, where people have been maybe not taking care of themselves as much. They're maybe transitioning from college to the real world, as people would say. But we'll see it sometimes as too, is they'll have mono, or they'll have an illness. And they'll think they've recovered, but they don't realize they probably didn't quite fully recover. They will feel normal again, but they don't realize the demand that illness puts on the body. And we're going to see that right now with COVID.
Oh, definitely.
Where the people are going to have this lingering effect. We see it with Lyme disease as well, where the disease, can put a high burden on the body, and the injury to the body is greater than just the illness of the infection. And so what we look to do is we look to make sure we try to seek to empower the body to heal what it can. And I think we have to have reverence for the fact that there's a trillion cells, more than a trillion cells in our body. And if we calculate it out, there's a book called Scale that I would recommend for people that really want to get into a heady experience, but but they talk about there's a trillion different calculations that your body's doing every single day. So we have to honor that your body is taking care of itself for the most part. And if we nudge it or support it, it will take care of some of that for us. And then we can go and take care of the stuff that's left over. And so rather than feeling like we have to do one thing for everything we're doing, that we have to have salmon this week, and we have to do mindfulness-based stress reduction, and we have to do, it's like, we can help with the fundamentals, and there may be programs that people like to embrace, and then maybe programs that people do not want to embrace. And so we just make sure that people have access and ideas as to what to do there, while we're taking care of whatever condition or issues we're addressing. But usually that initial stressor gives us the root, and then we look for the stem, and then we look for the branches. And so rarely does a person have completely separate concurrent conditions. They're often linked together, and there's an interesting kind of concept of constitutional diagnostics, which is kind of like a person's personality, but it kind of goes through their body type and how their body reacts to stress. And it has to do with their preferences and that type of stuff as well. And so it helps us to know that within the constitution, a person will oftentimes have diseases that are normal within their constitution. And so if we help support their body and their health as a whole, those diseases become less and less by their own nature. And then, and then every once in a while, there are diseases outside the person's normal constitution. And the prognosis is a little more challenging there, but at least it helps us understand that. And it does help people to understand that, because the people will often notice, like, I always have these same stressors. It's every 6 months, it's every 2 years, it's every, whatever. And people have diminished that over the course of time. And sometimes it's nice to be validated with, like, I knew that was something.
Yeah, I think that's true. It's very nice to be validated. And I hear so often that patients are feeling that they're not being validated. So I appreciate you saying something about that. That's very important.
Yep. Yeah. We feel that's the best space. If we could just be open and just accept whoever comes in with whatever they need, that would be the ideal for us. Is just helping people, walk through the transition of their days, and and refine their positive experience. And so we want people to pursue health, which is different than avoiding disease. And so pursuing health can be inclusive of avoiding disease, but avoiding disease doesn't necessarily lead to the experience people want to have. And so we want to make sure we do both of that.
I really think you should write a book. At this point in time, I'm in a full agreement with everything that you're saying, and everyone needs to hear this. So, on the opposite end of the spectrum, what do you think are some of the biggest frustrations that patients have before coming to you and your team, or exploring integrative healthcare services?
Probably the biggest is continuity of care, and just feeling like someone's looking out for them. So someone is giving them some advice that isn't kind of dismissive, and we all want to make sure we acknowledge, like, there are people that are in the system that care deeply about the people they're treating, and they're not empowered to do more than they can do. And so I don't want to make it an issue of people. It's a paradigm. It's a shift that we have to look for in the system of making sure that we can and we are looking for what does a patient need? What is the patient going to need? Like, what can we anticipate their needs, a month from now, or if we have an individual right now who's going through a diagnostic, and the diagnostic didn't lead them to a specialist, and that's a problem, right? And so that continuity of care is problematic. I think the next part is health literacy. I think if you look even in the research of health literacy, most of the research protocols are from the 70s, and I'm open to having missed some, but most of the ones I'm familiar with are just simple things from the 70s. And health literacy should be about can the person see an experience in their life and say, what can I do with this, right? Can they identify as do they know it's a migraine? Do they know it's a cluster headache? Do they know, or can they do that? And Google helps with that, and also Google compounds that. And but it's this ability to understand what a person's experiencing and then trust themselves to be able to make the right decision to seek out the proper care. And so I think those are probably the big things. So most people, because we don't have the continuity of care, they don't necessarily trust themselves to make decisions because they're confused on what they're getting, the information they're getting. Or they don't understand the experience well enough to be able to maybe link it to a diet, or link it to sleep, or link it to a stressor. And so those are probably the two main areas there.
So how do you collaborate with other care providers? Say I have a rheumatologist, I am working within my primary care, and I also have a podiatrist. How do you all collaborate together?
Yeah, for us, we have no problem collaborating with anybody. And so the continuity of care, the trajectory of the patient's or the individual's experience is the key. And so, yeah, so we get, for lack of a better term, a little defensive for our patients when we see them being manipulated or placated. And so we have some issues there that, but otherwise it's, we don't have any, we've worked with everybody. We have some cardiologists we like working with, and we have some rheumatologists, and we have pretty much the full spectrum. So we have no issues working with anyone and making sure that the outcomes are ideal for the patient.
That's important to note. Now, what about families? So, you're working with one patient, but that patient has a family. So I liked your tree analogy earlier, but here's the tree, that patient with the trunk and the branches that you talked about, but they're in a forest. And that forest is the family and the friends that surround them. And sometimes those are the trigger point. Other things going on in that family that have affected. How does that come into play?
I just have to interrupt. It's like, can you hear that rattling? Can you? Can you hear the rattling? That's because there's a woodpecker banging on my house.
Oh, interesting. We were just talking about the tree, so I think that
I don't
that's
know if you could pick
validating.
it up or not, but it's like I didn't want to quite interrupt, but it's like I thought it would just go away, but it's like it's still there. It's like, so maybe it's moved on, but I don't know if you can edit that part out, but if you can, so far it's quiet now, but
I think it's just there to point out the fact that we're all living in an interesting time period right now.
yeah,
You know, where we're working on that care model, but there's things going on around us, and sometimes they're distracting. So I think
right.
it's wonderful that these things sometimes happen during our interviews, because it just reminds us of how complex our lives
We're in a different space, aren't we? Yeah. Yeah.
um,
Yeah.
but
So
speaking more directly about friends and families, and you're treating an individual, but do you sometimes feel like you're almost trying to treat or care? And I don't even know if I like the word treat all the time, but I
right.
like the word care better, for the whole family unit.
Yeah, for sure. That's quite consistent with our experience in this space for sure. Is we will oftentimes influence the whole family just because we're talking about stress, diet, and sleep. We're going to talk and for a lot of the patients that come in, by them observing their own stressors, they start to see how stressors affect their family members. And they start to, and that's for us probably the satisfying thing about that is like, because that's the health literacy component for me, because that means they're actually internalizing this. They're seeing an accessible, everyday kind of concept or interaction in their day, and they're able to communicate it to somebody else, which means they understand it well enough to be able to share it with somebody else. And so this is to me why it's so important to actually make this available to people, because I think we're used to the concept of frontier medicine where we're reaching way out in the future, and hoping that we'll have a major solution, and it's just that's not to say that it can't happen, or not say that we wouldn't wish it to happen, um, but if we go back to these fundamentals, we get back to the basics, we can make this accessible to anyone, anywhere in the world. And it's just a matter of making sure we deliver it, appropriately. And we know that the shortage of people, so even going back to the WHO's, ambition, for the latter part of the last century, they at the 30-year mark, the World Health Report was primary care now more than ever. So that was 30 years after the Declaration of Alma-Ata, where they declared that primary care was the need. And the shortage of primary care practitioners, and those are like midwives and doctors and nurses and stuff like that. So there's quite a few layers of practitioners there. There's a shortage worldwide. Like I haven't seen the data recently, but the one I'm thinking of, I think, was somewhere around 4.5 million practitioners short, or that was needed to be able to serve the world that where we need to. And so if we can get it so that we can be more accessible, make it more accessible, make it more about where they live, so bringing it closer to where people live and work, then we can begin the healthcare component there. And then if we need to send them to get an MRI or send them to a clinic, we can do so. And that continuity of care can be embraced. So rather than waiting for something to become serious enough for them to go to a clinic, and we know that's a problem as well, and that's a worldwide issue, where people wait too long to go get care. But if we can get the interaction as close to home as possible, then we're going to be able to, most people kind of get it. They get it when they haven't slept well. They get it when they ate something that didn't feel good. They get it when stress is a dominant factor in their day. And so we can help them, process that, and then with the experience we have, we can make sure that they have the continuity of care through whatever other elements they need.
Very good. And are you treating only adults, or are you also seeing children or adolescents?
We see the full spectrum. So we just had We just had a 3-month-old,
Wow.
that was a month or two ago, and about a month ago, and I think our oldest was 94, I think.
Excellent. Excellent.
So yeah,
Very good. Well, I want to thank you for this crash course in
sure,
integrative healthcare. We do look forward to learning more through your courses that will be focused on these foundational healthcare services, some of which that we discussed earlier. And we value your beliefs that the pursuit of quality of life must be the target of a new standard of care when considering chronic diseases. The world has certainly changed, and it's changing rapidly before our eyes. So having this new understanding is important, it's valuable, and it's going to help people across the world. So thank you so much for joining us today, and we'll look forward and share when some of your courses are launched so that others can come join and learn about those specific areas like women's health or weight management or arthritis, allergies, so many great areas to focus on and learn more. So thank you
sure.
very much today.
Thank you, appreciate it.
All right. Have a great day. And
You as
thank you
well.
all for learning along with Dr. John Blaska and I here at How Are You?